Amy, would you like to ask a question, and where are you from?
Hello. Yes, I'm from San Diego.
Okay, go ahead.
I have a question on miso. I love miso, and I had a book. It was a real old book about miso, and the authors, traveled to Japan. They made miso, and it's a really awesome book. And they said that for some reason, miso does not raise salt levels in the body. And I found that interesting because I was in the hospital a while back, and they did my blood pressure. I thought, oh no, I I love miso. Watch out! And my salt level was my blood pressure, everything was absolutely normal. And I was really shocked because I thought, huh. And I don't know if you have any evidence or know anything about that. And I'm not promoting anybody. Please do not just eat miso and say, it doesn't cause any sodium problems. Please don't take that as that way. My inquiry is if either of you gentlemen, and you guys are doing an excellent job, have any information about miso.
I actually have a jar of miso in my refrigerator most of the time. And I will agree, it's an organic, good brand, but it is a very salty product. And I can actually only for the flavor, because I'm so unused to salty foods. It's a little dab will do you in my life. I actually enjoy it, but it's a fermented food, and it's high in protein and all the components that make soy a good choice in anybody's diet, but certainly in a plant-based diet. But I'm unaware of a research study I can quote you. Traditionally, blood pressure in Japan is lower than the Western cultures, so they don't seem to be suffering from miso, but I'm not sure the quantity, how much miso goes in a cup of miso soup. I think very little, actually.
It's a great answer. I don't have anything to add.
Yeah.
Alexin, do you have a question, and where are you from?
Hello, I'm from Monterey, California, and I am on a vegan diet, drinking maybe a gallon, a little more a day of water. And I know you addressed salt a little while ago, a few minutes ago, but I didn't catch how much salt should I be adding salt to my diet, or iodine, because I drink so much water.
Yeah. Why don't you?
Yeah, so I mean, I think roughly we kind of estimate the human needs roughly around 1,500 milligrams of sodium that, and you're able to get quite a bit from the foods that you eat. So there may not be a need for you to kind of really focus on added. I would presume that with your raw, you're probably having more than just salads, and probably doing things that are dehydrated and being adherent to the temperature in terms of your preparation. So I would probably imagine that there's probably a limited need. And I would maybe even suggest that you might track, there's lots of trackers out there as you put in your food that will actually give you a breakdown of your of your sodium, potassium, the minerals, the fats and carbohydrates and fiber, as you enter into it, like MyFitnessPal and some others, that might provide you like a real hard perspective on how much you're intaking on a daily basis based on what you're eating.
Okay, I'd like to ask you a bunch of questions that you could just give us a thumbs up or thumbs down. So we don't have time for detailed answers, but just to send us in the right direction in terms of, is this something that you are saying no problem, yes, or you're saying avoid? So I'm going to just make a list. You could use the words yes or no. You could use your thumb, whatever you like. Okay. So, and I guess this relates to overall health, but especially to heart health. Number one, alcohol. Okay.
I feel like we're about to play rock, paper, scissors.
So that's a no. Is that all alcohol, including a glass of wine?
It's a public forum. We have to give the public answer.
Okay. Next question, coffee. Okay.
He's giving neutral.
But it's all the other stuff.
Yeah.
How about fasting? Let's call it water fasting. Okay. How about coconut products, meaning coconut yogurt, coconut ice cream, coconut oil.
No.
How about saturated fats in nuts that have a lot of saturated fats like macadamia, cashews, and Brazil? So raw macadamia nuts, raw cashews, raw Brazil nuts.
Raw.
Okay. How about DHA, EPA supplements that some people have said we need for dementia prevention? So like algae oil, an algae oil that is should be used as a DHA, EPA supplement.
I'll give it up. I'll give it up.
Okay. How about supplementing with magnesium? A mineral magnesium.
I'll give it up.
Okay. I don't know if we covered the subject of stents, but is this something that at times is appropriate? Okay. And then I guess this is too big a question to really throw in here, but I'll throw it in anyway. Even if you're pro lifestyle, is bypass surgery something that at times is necessary? Okay. How about far red infrared saunas? Because someone's going to be in their heart, they might be concerned going up to 135 degrees. You're okay with that. Okay. What about cold water plunging, where you go into freezing water, and while it might have health benefits, it does seem a little shocking to your body. You have any thought on cold water plunges?
I hate it.
No research on it on my part.
Yeah, there's no research, but yeah.
It's
more a fad right now than anything.
aside from it might not being beneficial, are you concerned that it could be dangerous and cause a heart attack?
In some people, there's actually lots of data for sauna. There's, safety data too. There's just absent data for, polar bear jumping into the lake or your garbage can full of ice.
Is cold, if someone goes skiing, do you get heart attacks if it's too cold? Is that a thing, or is that something to be concerned about, being out in too cold of weather?
Yeah, it's a strain. It's a stress. We did this silly study in my hospital where we actually had people wearing Holter monitors, shoveling snow in the hospital parking lot, and we published it. And you can reproduce a stress test by cold weather with some physical activity.
Okay. Supplementing with iodine. Some people say that it's no longer in the food and it's an important thing and hard to get.
Yeah.
Okay. How about olive oil, extra virgin olive oil in a dark glass bottle? Are we trying to avoid this? Neutral, not have it?
Literature says it's okay.
Okay, so if that's olive oil, and then what if someone said, what about high quality hemp and flax oil? Is that also the same as olive?
I don't have research for that.
Yeah, I'd give it an. There's other ways to get it. Always do the seed.
Okay. How about CBD is a popular thing? Is CBD products? Any thought on that?
Give them neutral.
Yeah.
Okay. How about people who at night say, I need to take a very small amount of a sleeping pill to help me go to sleep? Is this a heart issue at all?
Yeah. I'm assuming you mean that some sort of anxiety.
Yeah, prescription. Yeah.
So
yeah,
not good.
Okay. What about we've been told that nitric oxide is good and that you get it in green vegetables. Are you concerned about oxalates from too many green vegetables? Is that a concern, or should we have as many green vegetables as we can?
I don't know what to do with my thumb. Not concerned.
Yeah, I'm not concerned either.
Okay. Someone says, I heard your lecture. I'm not going to have any more beef, so I've been eating Beyond Meat and Impossible Burgers every night. Is that better, worse, neutral? Is it still not so great?
Yeah, it's not great. It's better than the red meat, but it's not great.
Okay. Sea vegetables, kelp, nori, wakame. Do we want to try to add these in our salads? Does it not matter? They seem to have salt in them, but good. Okay. The whole thing from years ago when they talked about lectins, does this concern you in a plant-based diet? No
And
concern.
not concerned. Yeah.
Yeah,
Okay.
no.
And then I guess someone says, all right, I understand everything you're saying. I've read your books. It totally makes sense. I logically could take a test and get the questions right, but I live in the real world and people like to sometimes socialize at restaurants, and sometimes people order dessert, and sometimes people order a drink. So the question really is not what is true, but how extreme do we need to be? Meaning, yeah, how extreme do we need to be? People want to have some dessert. They want to have some alcohol. They want to have some of everything. And some of us are super disciplined and can be militant about it. But a lot of people are saying, I got to have a balanced life, and it's too hard to be 100%. So how strict do you need to be to get the results that you need to protect yourself on everything?
I think very. I'm not going to say 100, but I think very. I mean, I think Dr. Esselstyn gets credit for the quote, moderation in diet is like moderation in, atherosclerosis, moderation in bypass. So you do want to be very attentive to your diet now.
And I would say it's like locking your doors and saying the alarm and leaving your windows down.
Yeah.
Okay.
Good analogy.
Okay, if each of you could give us any final closing thoughts that you want to leave us with on cardiovascular health. Dr. Kahn, you want to go first?
Yeah, I'm not sure it's completely preventable. I'm not sure it's a paper tiger, but I sure know we're underselling the idea that starting in youth, really, that's when we need to be teaching in, elementary, middle, and high school and college, that, this is a lifestyle-driven disease to a very large extent, and it's a lifestyle controllable disease. The younger you start, the better you'll be. And we hopefully will have a Real Truth About Health conference in some future era where we don't have to talk about heart disease because we've grabbed onto lifestyle. So, do the lifestyle, do the testing, and be a student for life, because things do change over time.
Thank you.
Love it. I would just add a couple of words. One is be intentional. Be intentional on what you're saying out in your plans for the day in terms of what you're going to eat, how you're going to move your body, feed your body, and rest your body. I think be intentional in terms of your expectations of your docs, in terms of the knowledgeable about the studies that you need to know, and asking what does this mean and why, as opposed to just accepting. And I think decrease the stress, the worry. Decrease these play a substantial role in the manifestation of disease. Study after study is telling this over and over. And so we have to focus on building what are you doing for your health, and as opposed to what am I not doing? I don't do this, I don't do that. What do you do for your health? What are you eating for your health? Focus on that. And you make that the goal of every single day, your gratitude, your forgiveness, all those components. That's some of the keys towards living an enjoyable life. In other words, they call that the dash between your birth date and your death date. That dash, you want that as enjoyable as possible.
Thank you.
Amen.
Dr. Kahn, how do we follow up with you, stay in touch with you, contact you? How do we get in touch with you? How do we get more information from you if we want to stay in touch with you?
Central website, drjoelkahn.com, drjoelkahn.com. Link to the clinic, link to my podcast, books, and blogs and videos.
Okay. And
Thank you.
If someone wants to do a consultation with you, you will do a Zoom or a phone consultation?
Yeah, in about 20 states I'm licensed in, California to New York, but it's not 50 states. So I do follow the rules.
And do they get to speak with you?
Yeah, only me. 60 minutes on the clock. Yeah.
Okay,
The
great.
joy. I love it.
Thank you. And Dr. Batiste, how do we stay in touch with you and follow up with your work?
Yeah, drbatiste.com is the easiest way. We're creating a community just to kind of bring out the pillars of selfish, really, as we kind of move forward. And social media there too as well. Columbus Batiste can find me.
Thank you very much. I appreciate both of you. Can we unmute so that everyone else can say thank you as well?
Thank you all.
Selfish.
Thank you.
Big X.
Thank you so much.
Yeah.